and I want to go back from a dementia standpoint. When they're diagnosing someone with dementia, you want to make sure that they've looked at any reversible cause. Um, Things like hearing. You'd be surprised how many patients come in and they think that they're having dementia, but they can't hear. And or vitamin deficiencies like B12 and folate. Their thyroid levels could be off. Those things can cause you to have issues with cognition.
Let's talk about your viral video. The scariest thing I've seen as a neurologist, you mentioned that muscle weakness was what you had seen. And so if you could please explain the importance of that and how does that affect us neurologically?
So when people think about retirement, and a lot of my patients are, at that age, they think about resting, like sitting down somewhere, not moving around. And that's probably the worst thing that you can do is sit down once you've retired. Um, and the video came from me having a conversation with a patient who said, I think I have sarcopenia. And I said, really? You think you do? And he said, yeah, I think I have it. I said, well, what makes you think that? He said, well, I just keep getting so weak. I'm so weak. I said, well, what are you doing to not be weak? And he just looked at me like I had two heads. I said, I'm serious. What are you doing? And he said, well, I don't know. I said, are you exercising? He was like, no. I said, are you doing any calisthenics, lifting weights, anything? And he was like, no. I said, then you might have sarcopenia. You might be getting weak. I mean, you probably are. And he said, really? And then I broke it down and talked about the muscle loss, that 1 to 3% every year that you don't do something, because you really truly lose it if you don't use it. And it's about the growth factor that comes out when you're actually lifting weights. That growth factor goes to certain parts of your brains and enhances those parts of your brain. Those pathways that we talked about before, those pathways get stronger and stronger and stronger the more you utilize your muscles. So those things are things that I was seeing, that I can see people just not doing it and thinking that it's not for them as they age.
Right.
Muscle strengthening is not for them. And I'm like, no, that's far from the case. Like, you absolutely, even if you haven't done it in any part of your life, this is the time of your life that you need to be doing it, because you want to age gracefully. You want to be able to play with your grandkids. It's not
Yes.
about looking good on the beach anymore. It's about being
No.
able to be mobile and do the things that you want to do, because most of us are going to age well here, but we
Right.
want from here down to continue to be with this. You don't want to be trapped in a body that won't move.